I'm going to talk about the physical aspects of laser therapy in medicine. What is laser therapy? Laser therapy is a medical treatment that uses a strong beam of light in specific wavelengths to cut, burn, and destroy tissue. The laser doesn't have major health risks to the patient or medical personnel like other radiation therapies might have. There are some risks, though, with laser therapy as well as open surgery. For example, if there's laser therapies used on a brain tumor, it has the same risks as open surgery, including pain and bleeding, but the recovery time is faster. Some examples where laser therapy can be used is eye surgery, removal of prostate, removal of kidney stones, removal of tumors, skin surgery, and sealing of nerve endings and blood vessels. So it can be used in very many different ways in medicine. But how does a laser work? Before I can explain how a laser works, I need to explain the three unique properties the laser has and what properties makes it a laser. So line width is the width of the band of output frequency of radiation. Frequency is how many oscillations happen per second. And it can be described as a sinus wave. If these frequencies are put together, it will become a wavelength. So every frequency represents a wavelength. The narrower the light, the closer it is to one single frequency and one single wavelength. So the smaller the light or narrower, it's going to be one frequency, and for example, a wavelength of 700 nanometers. This will make the light one color, because the wavelengths, they don't have to be the same, but if they are similar in a small range, for example, 630 to 700 nanometers, it will represent the same color. So it's not like a normal lamp where the wavelengths are not the same. It represents different colors, leading to the light becoming white. But lasers will be a specific color. It will be green or blue or red or some other color. The next unique property is coherence. Like you see in the picture, sunlight does not have coherence. The light is not in the same phase or has the same direction or pattern. It has different wavelengths representing different colors, and it is not in a pattern. So it's not coherent, and it doesn't have the same wavelength and same color like I talked about before. A LED lamp, example, traffic light, it's the same, it represents one color. It's red, for example, but it's not coherent because you see the wavelengths are the same, but they are not in the same pattern. They don't align like the last picture. They're the same color, the same direction, and this is what a laser is. It's coherent, and coherency practically means that we can focus it on one spot. It doesn't have to be like a normal, like a traffic light. You can't focus it in one spot. It's gonna be all over. The third unique property of laser is power, and this one is important in medical aspects, and as well as military is researching on it, and I'm gonna come back to this property later. For further explanation on how laser works, I'll need to explain what the term laser stands for. It stands for light amplification by stimulated emission of radiation. To explain this, I'm going to break down the long term into parts, and we're going to start with stimulated emission of radiation. To explain stimulated emission, I need to explain two additional terms: stimulated absorption and spontaneous emission. Stimulated absorption is when there's an atom with a proton and electron. The electrons are found in the ground state, which is closer to the proton, and in this state, it's in its lowest energy state. It will want to be in this state because it's more stable, and it doesn't want to react with other atoms because it wants to stay in the same way it is in the ground state with less energy and more stable. But when stimulated absorption happens, a photon, which is a particle representing light filled with energy, the photon will come by the go by the electron, and it will have an energy input into the electron, which will make the electron jump to a higher shell or higher away from the proton. I'm going to show this. There's a video that will show perfectly what's going to happen. So there's the photon that comes, energy input happens, and the electron jumps up to a higher state away from the proton. This state is called excited state, so the electron is excited. But like I said before, it doesn't want to stay in this state because it's not stable. It wants to be in the ground state, closer to the proton. And the process where this happens, the reverse of spontaneous stimulated absorption, will be spontaneous emission. So spontaneous emission is when, after a short time, about 100 nanoseconds, the electron will fall down to the ground level again. And to be able to return to this ground level, the energy that was put in to the electron in spontaneous emission will have to be released. So when the electron falls back, if we say it easily, it will release energy. And here's another video that will show the electron is excited, it's higher in the higher state, energy state. So when it falls back, when it falls back, it will release energy gained in the first video, and the photon will be released again. So now when I explain these two terms, I can explain what stimulated emission means. Stimulated emission will be when a photon interacts with an already excited electron. So the electron is already in the higher energy state. So when the photon interacts with the electron, it won't absorb energy. The energy won't be absorbed by the electron because the electron already has absorbed energy before. Instead, the electron will fall back to the ground state after interacting with this photon, and the result will be two photons, since the electron releases energy when it falls back to the ground state from the high energy state. The photons that are released will be identical in frequency, and they will be coherent, so they will be perfect for the laser because those are the two properties I described before. You can see this in this video. The photon will interact with the excited electron. The electron will fall back to ground state, and during this it will release another photon. And like you see, they are identical. Some materials can do this while others can't, because like I said, the electron will only be in the excited state for a very short time, and the photons won't have time to react with the electrons, creating another photon. But some materials have a phase called metastable state. So this will mean that if it has metastable state, the electron will stay in the higher level longer, therefore giving the photon time to interact with multiple excited electrons, creating multiple identical photons. So there will be more photons because it has time to react with many atoms. So the other part of the term laser is light amplification. If we would just do the stimulation emission, like I described before, we would need a very long laser because it has to go through multiple atoms, and if the atoms were just in a row, then it would need to be very long to be effective. Therefore, there has to happen light amplification. So we're putting in a cavity in the middle of the laser, and the cavity has a mirror on one side and a partial mirror on the other side with atoms in the middle like you see in the picture. When light waves enter the cavity, it will reflect in the mirror, going through multiple atoms, so it doesn't have to go in a chain, but it does stimulated emission in these atoms by reflecting and bouncing back and forward in the two mirrors. And like you see in the picture, it will slowly amplify. There will be more waves, more photons. And the partial mirror in one side will later release these or some of these waves, and there will be a beam of light created. Lastly, I will show how it can be used, how the laser can be used in medicine, and I will take an example with brain tumor removal. It is very useful because if we need to operate like a tumor in the picture or the video, we need a minimal invasive surgery so we can reach the part of the brain with the tumor without harming other parts. For example, in this video, you can see if there would be open brain surgery, you can harm the visual part and the patient might be blind after the operation. So a laser therapy is perfect in this case. So what happens is that a laser is inserted in the brain, and when photons from the laser are absorbed by the cells in the tumor, the energy is converted into mechanical energy. The kinetic energy, which is a type of mechanical energy, will increase the temperature in the tumor because temperature is the average kinetic energy. So if there's more kinetic energy, the temperature will be higher. So when the cell absorbs this kinetic energy, the temperature will rise and the cell will be either damaged or it will die because of the high temperature, because cells can't survive in that high temperature. And the result will, though, after this laser therapy, be that the tumor will either be destroyed or damaged, so it can't grow anymore. So it's a very useful therapy in medicine. That's all I have to say. Thank you.